Bonjour à tous. Si on peut avoir la carte, s'il vous plaît.
Good morning to all. Here is the
Tout
map.
d'abord, on va avoir une présentation.
So
par
first we'll
Erika
have a
Simons,
presentation
de
by
la revue de
Erika
mortalité
Simmons.
rétrospective sur les
It's
camps de Ourang,
a
Tumtuma et
retrospective
Arkoum qui sont au Tchad.
mortality study
qu'on a,
in two refugee
lancé,
camps and
suite
returnee
aux
camps in
hostilités
Chad
qui ont lieu au Soudan depuis,
after
le 15
the
avril 2023.
conflict
Donc, le 15
that
avril
burst out
2023,
in
les
Sudan
combats
on
couragent,
15th of April
à Khartoum
2023.
entre
Lots of
l'armée
fighting
régulière
in
et les SAF
Khartoum between the
les
regular
Rapid Support
governmental
Forces,
army and the
les forces de soutien
RSF,
rapide.
the
Et
Rapid
à partir de
Support
ce moment-là,
Forces. And
à
from
cette même
that
date,
time,
les tensions commencent au niveau d'El Geneina,
tensions
qui est au Darfour
rose near
occidental.
El Geneina
Et
in
ça
western
ravive des tensions
Darfur,
anciennes entre
and that
notamment les
reignited
Massalites
all
et
tensions
des milices
between
arabes.
Massalites and
Des
Arabic
camps de déplacés
militias.
internes dans cette région sont brûlés.
There are
On nous
IDP
rapporte qu'il y a
camps
des
that
blessés et des
were
morts qui s'entassent dans la
put
ville.
on
Et
fire.
à partir de mai
Lots
2023,
of
donc vraiment
casualties,
le mois
wounded
suivant,
people, dead
on entend
people in the
des
streets,
rumeurs
and the
de centaines
following
de
months
blessés non
there
arabes qui
were
sont piégés dans la
rumors of
ville,
hundreds
faute de
of wounded
négociations
people,
possibles
not
pour les
Arab
évacuer vers le
people,
Tchad,
and
avec les
that
milices qui
couldn't be
détiennent la route entre
evacuated
El
to
Geneina et
Chad
Adré.
because
Et
militia
donc,
were
ces populations
blocking the
là
road
restent à
between Al
l'intérieur,
Janina
et
and
ces blessés
Adre.
restent à l'intérieur
So the wounded
d'El Geneina
people had to stay inside
à
El
partir
Janina.
du 15 avril, donc
And that
jusqu'au
was
15 juin.
from
Le 15
April
juin 2023,
15th to
le gouverneur
June
du Darfour
15.
occidental est
On
assassiné.
June 15,
Le gouverneur du Darfour
23, the
occidental est un
governor of
Massalite.
Western
Et cela provoque un
Darfur,
départ massif des Massalites de
Massalite,
la
was
ville.
murdered.
Plusieurs attaques ont lieu
So
sur ces
all the
populations alors qu'elles
Massalites
fuient vers
left
le
the
Tchad.
city, and
La
the
semaine du 15 juin, nous recevons plus de 1000 blessés qui sont
populations
essentiellement par balle et
fleeing
essentiellement
towards
des hommes
Chad
à
were
l'hôpital
attacked.
d'Adré au Tchad.
We
Hôpital qui est
had so
soutenu
many
par
wounded
MSF France depuis
people
2021.
in the hospital that MSF is supporting there in Adre, 25 kilometers away from Al Janina. Following the outburst of violence between April and June, and with this mass influx of patients, wounded patients, and people on the move, 570,000 Sudanese refugees arrived in eastern Chad. So we asked for a retrospective mortality survey to try and better understand what happened around Al Janina.
Donc on a choisi 3 camps.
So we selected 3 camps.
La carte, je vais essayer de vous expliquer.
Here they are on the map.
Très différents.
3 different camps.
Desquels venaient de 3 endroits différents.
Because the population in the camps came from 3 different locations. Can you go back one slide? Go back to the map, please.
Alors, on a choisi un premier camp.
So we chose a first camp, Tumtuma, that was considered as a returnee camp. That is Chadian people living in Sudan and who came back after the outburst of violence, although it's a bit more complicated. Then we also selected the camp of Arkoum. That was the first new camp that was set up in Chad at that time. And people came mainly from Congo, Western, and they settled in Borota and Mungor, 2 towns. They were the first to be located by or resettled by UNHCR in Arkoum. And the third camp we decided to survey sheltered a population coming from Al Janina, and they fled to Adre in that very harsh week following the 15th of June, and they were resettled in Ourang. So we selected quite diverse populations to see if we could identify something specific to Al Janina.
Donc, Erika va maintenant
And now Erika Simmons will give us her presentation. Erika Simmons is an epidemiologist working with MSF and Epicentre since 2014, particularly in African contexts. She works on cholera, Ebola, HIV, malnutrition, measles, meningitis, and population displacements. And For 2 years now, she's been supporting in a great way the emergency cell.
Hello, today I'm happy to start us off with a presentation of results from a series of retrospective mortality surveys done in August and September of last year in 3 camps in eastern Chad among Sudanese refugees and Chadinese returnees who had fled the violence in Sudan. So Claire already touched a little bit on the context, the situation, but since April 15th of 2023, the civil war between the Sudanese armed forces and the paramilitary rapid support forces has caused a major crisis in Sudan. So violent fighting broke out all over the country, including Darfur, considerably exacerbating already existing inter-community tensions. By September of last year, more than 420,000 people had fled to Chad, including over 327,000 in Wadai province alone. These people were mainly Sudanese refugees, but also returnees, Chadian nationals who had been living in West Darfur before the outbreak of violence. So in order to better understand, describe, and respond to this existing situation, our study objectives were the following: to describe the population in terms of age, sex, and origin, to retrospectively estimate the crude mortality rate and the main causes of death during the recall period, and finally, to assess the frequency and type of violent events that were experienced by household members during the recall period. So as described by Claire earlier, we carried out cross-sectional retrospective mortality surveys in the camps of Tumtuma, Orang, and Arkum in eastern Chad, so 3 fairly distinctive camps as described by Claire. The minimum sample size calculated was 1,026 households per camp in order to achieve a representative sample of each of the 3 camps. In Tumtuma camp, we selected the population using systematic random sampling. In Orang and Arkum, we used spatial random sampling based on a random selection of rooftops from the most recent satellite image available. The survey included a face-to-face interview with household head using a standardized questionnaire, information on age and sex of the household members, and dates for new arrivals, births, departures, and disappearances, and deaths were also noted. To assess mortality, the household head was asked if any deaths were reported during the recall period, and further information including age, sex, reported date, cause, and place of that death were collected. Episodes and violence and the type of violence, including beating, sexual, shooting, stabbing, detainment, kidnapping, or other, were also recorded for all of the household members. So we considered a recall period from January 1st, 2023 to the date of the interview with 2 phases. The pre-crisis phase, which was from January 1st until March 14th in Tumtuma and until April 14th in Orang and Arkum. The crisis phase was from March 15th to the day of the survey in Tumtuma and April 15th to the day of the survey in Orang and Arkum. Among households in Tumtuma camp, we considered an earlier start date in the crisis phase due to inter-community tensions that erupted at the end of March in West Darfur and drove important population displacements towards Chad. So the 3 carries were carried out in August and September of 2023. More than 1,000 households were included in each of the 3 camps, with an average household size of 5.9 in Tumtuma and Orang and 4.9 in Arkum. Here we can see the age-sex pyramids for the households included in the 3 camps. So we observe a clear underrepresentation of men in the age group 15 to 29 years old in the 3 sites, with the sex ratio indicating 6 to 7 men for every 10 women. In Tumtuma and Arkum, we observe similar tendencies also in the age group 30 to 44 years old. So you've already seen this, been introduced to this map by Claire before, so we present here the village or town of the origin for the households included, as well as the location of the 3 camps. So all 3 of the camps are on, well, let's not try that. Okay, all 3 of the camps are on the left side of the map and highlighted with camp symbols. The circle size indicates the proportion of households coming from each location. In blue, those from Arkum, and red, those from Orang, and green, those from Tumtuma. As you can see, almost all of the households surveyed came from West Darfur. In Oreng and Arkum, 99% of households were refugees, and in Oreng, 91% came specifically from the town of El Geneina, while in Arkum, 47% and 33% came from Congo and Mistore, respectively. In Tumtuma, on the other hand, 60% of households were refugees, 36% returnees, and 4% internally displaced. The majority came from Umdam, Tandoti, and El Geneina. So in all three camps, the crude mortality rate was significantly higher during the crisis phase than during the pre-crisis phase. The mortality rate was particularly high in Oreng, where we observed 2.25 deaths per 10,000 people per day during the crisis phase, compared to 0.11 deaths per 10,000 per day pre-crisis. In addition, many households in all three camps reported missing members, with disappearances during the crisis phase ranging from 0.5 per 10,000 per day in Arkom to over 1 per 10,000 per day in Oreng. So here we present the crude mortality rates by sex. So as with the crude mortality rate, the rates are significantly higher during the crisis phase. Among men in the Oreng camp, the specific mortality rate is particularly high, which goes from 0.6 before the crisis to almost 4 during the crisis phase, which is equivalent to a 24-fold increase. Among women, an increase in mortality was observed during the crisis phase among households in Oreng, but no significant differences were observed in Tumtuma and Arkum camps. Although not presented here, we observed similar trends for mortality in children among children under 5 years old, with a significantly higher rate during the crisis phase in Oreng camp, but no significant differences for Tumtuma and Arkum. So here we present the cause of death, so violence, and more specifically shootings, were the cause for the majority of deaths in all three sites. So in Tumtuma and Oreng, deaths linked to violence were the cause for around 80% of deaths. In Arkum, half of deaths were linked to violence. Diarrhea was the second leading cause of death among households in Tumtuma and Arkum, and measles in Oreng. Most deaths occurred in the village of origin or during the displacement towards Chad, with few deaths reported after arrival in the three camps. So here we present the number and percent of violent deaths by age group and sex in each camp. So what is particularly striking here is the deaths linked to violence among men 30 and older. Among households in Tumtuma, around 4% of all men aged 30 and over died of violent causes, and in Arkum, almost 4% of all men 30 to 44 died of violent causes among all household members. Among households in Oreng, more than 1 in 10 of all men aged 30 and over died of violent causes during the recall period. In addition, the disappearances that we referred to earlier reported by the households mainly concerned males in the age 15 and older. So here we present the number and percent of violent deaths by household of origin across the three camps, with the most frequent cities or villages of origin. In the three camps, if we pull all of the data together, 2.4% of all listed household members from El Geneina died from violent causes, around 5 times what was observed among households of all other origins. There was also several deaths linked to violence reported among household members from Mistore and Tandoti. So here we analyze the overall frequency of violence, i.e. the number of people in the household who had experienced at least one episode of violence during the recall period. Among all household members, the frequency was 3.3% in Tumtuma, 11.7% in Oreng, and 4.4% in Arkum. The main types of violence reported were beatings, 2.3% of household members in Tumtuma, 8.3% in Oreng, and 3.5% in Arkum, and gun violence, 0.9% in Tumtuma, 4.1% in Oreng, and 0.7% in Arkum. Few cases of sexual violence were reported during the survey. The risk of stigmatization and the challenges that are associated with confidentiality in camp settings may have led to underreporting of sexual violence and other forms of violence, including interfamily violence. So our conclusions are the following. We observed high mortality rates, with most deaths linked to violence, and excess mortality observed among men. The crude mortality more than doubled in Tumtuma and tripled in Narkum during the crisis phase. Households in Orang, mostly coming from El Geneina, appear to have been particularly affected, with the mortality rate 20 times higher than before the crisis. Mortality is probably underestimated due to survival bias. Households that completely disappeared before arriving at the camp or where surviving members joined other households are not represented in the sampled population. Finally, these surveys were not representative of all households that had fled Sudan, only those in the 3 camps included during the survey period. Populations who fled to countries other than Chad or who remained in Sudan are then not described in these results. The results show the importance of investigating and quantifying the extent of the violence suffered by these populations. Repeated retrospective mortality surveys combined with documentation of village destruction and population displacements are important to more concretely document the conflict and understand the conflict dynamics. Thank you for your attention. This study would not have been possible without the hard work and dedication of the study teams in the field and also the support of the MSF teams in Chad and France, including Pascal Ouedraogo, who implemented the survey in Chad. And we thank also the Ministry of Health and the camp authorities for approval and support during the implementation of the survey. And lastly, of course, we are really thankful for all of the study participants for their time and participation and willingness to share their experiences.
Bonjour.
Hello, everyone, and thank you very much for attending this meeting today. Now we're going to turn now to another setting, another context, which is also prone to high level of violence. It's Haiti, and so I'm not going to give you an introduction on Haiti because we keep mentioning this country over and over again. I'd like to tell you rather about the interest of having these population-based surveys in Haiti and the work of our staff in this particularly violent context, and also how difficult it is to measure the level of violence now in Sudan, in other countries. We mentioned mentioned violence, and we think it is important for us to objectivate the level of violence and bear witness to and speak out about what our teams go through and what the population, the communities go through, so that we can use this for advocacy. Now, we keep saying that Haiti is worse today than 3 years ago or 2 years ago, and it's true. But it's important to be able to prove what you say and also bear witness to what our teams go through. So the latest retrospective mortality study in Cité Soleil was carried out in 2008 by OCP teams. We had no studies in the meantime. I'll stand corrected, but it seems to me that no scientific study had been carried out. We had a lot of témoignages, a lot of people telling us about what they were going through, but no actual evidence. So, and in order to push this issue with donors, Lima, for instance, joined us in the field, and other NGOs such as the ICRC then took action following a communications campaign we conducted on our activities in Haiti, and also on the basis of this survey. And this survey was also very useful for us to look at our HR policies and duty of care. So we wanted to, we had this survey at a time where violence was very high in Cité Soleil, but we managed to carry out this survey. And we thought that, well, the population, the community in Cité Soleil were subject to violence, but our staff as well. So we decided to have this survey among our colleagues. Our colleagues may not live in the same neighborhood, but it's true. But it gave us an overview of what our colleagues go through. So it's another angle we use for this population-based survey. Now, let me introduce Thomas Roderer, who is going to tell you about what we did. Thomas joined us in 2007 before working on in the HQ. So this was back in 2007 that he joined Epicentre. He started with film missions, and he worked on nutrition, on mental health, COVID, and we are very happy to have him with us today.
Merci beaucoup, Sarah.
No, thank you very much, Sarah, and hello, everyone. Now, you gave a perfect introduction to the context of these two surveys. So let's now turn to the Caribbean to tell you about the outcome of two surveys that were conducted last year on mortality and violence in Haiti between 2022 and 2023. So let's go back to 2023, beginning of 2023. Haiti, unfortunately, once again was plunged into major political and security crisis since the assassination of the president, Jovenel Moïse, in July 2021. And there were conflicts between the gangs, and the gangs, in fact, have the upper hand on 80% of the capital city, Port-au-Prince. And throughout 2023, there was also an armed group, self-defense groups composed of citizens that decided to try and defend their neighborhoods. Of course, this impacts the lives of the communities, of the population. As you can see on this map, Cité Soleil is the neighborhood around the airport in Port-au-Prince, and the gangs hold 80% of the capital city. In fact, the two most powerful ones are the G9 and the GPEP, and they are very active in Cité Soleil. In 2023, they decided to join forces to impose their power on the city. Now, at the start of 2023, the United Nations communicated on the dramatic increase in the number of homicides and kidnappings, abductions in 2021, 2022, and on the massive displacements of population fleeing violence in the capital city. The health system, already quite dysfunctional, was almost paralyzed, and unfortunately there was also a new epidemic of cholera at the end of 2022, and this of course compounded the already existing crisis. As Sarah told you, a crisis prevented a number of NGOs from working properly in Haiti, and particularly for MSF we had to close hospitals, some of our staff were kidnapped, patients were targeted, and this was more particularly the case in Cité Soleil for OCP, but also for other MSF sections. And we could see that it was a bit difficult to see through the maze of statistics provided by the United Nations. We didn't have any precise figures or statistics for neighborhoods such as Cité Soleil, and we wanted to characterize the level of violence for the population in 2022-2023 with two retrospective studies to assess the crude and specific mortality rates during the recall period.
Alors effectivement, les conditions sécuritaires.
Now, the security was such that, well, for many months in 2023, we couldn't conduct the surveys. And the three sections, OCP, OCA, and OCB,
d'aller enquêter auprès de leur staff national, de leur personnel national.
Decided that maybe what they could do was to talk to their national staff and also to their staff's families.
Un peu plus tard dans l'année,
Slightly later,
dans la commune de Cité
in the summer, there was a relative calm in the town of Cité Soleil, so it was then possible to investigate more than 1,300 homes.
utilisait le même
The
questionnaire
two surveys used the same questionnaire,
qui avait pu décéder.
and they focus on members who died or were kidnapped,
Ces décès quand ils étaient survenus et sur les types de violences
and also the type of violence
membres des ménages.
experienced by household members.
Alors, à Cité Soleil, nous
Now, in Cité Soleil,
en deux zones.
we decided to stratify the commune, the municipality, in two zones. The red area, it's the north zone, where the gangs are less active and security is, well, let's say, relatively more guaranteed. And the south zone is in green here on the map, and this is the historical cradle of gangs and the location of the fiercest fights in 2022.
En mai 2023,
In May 2023,
819 membres
we were able to interview 819 MSF members, so it's only slightly over half of the overall staff,
donc un peu plus de 4000 personnes.
and this represented just under 4,000 people, with the members, family members of MSF staff.
A permis d'inclure
In August 2023,
total
the
de-
survey in Cité Soleil included 1,669 households for a total of 8,202 people. Now, these national staff, of course, is not representative of the population in Cité Soleil. You can see that with the age pyramids. You can see that, well, Cité Soleil
membres des familles de staff
population and MSF staff population, MSF staff people are slightly older, they have fewer children, and they are more elderly people. So it's
l'échantillon reste représentatif.
otherwise the sample is still representative of Cité Soleil. Our main objective was the evaluation of crude and specific mortality rates
Alors,
in
dans
each
l'enquête
population.
auprès du staff MSF, ce taux est très bas.
Now, it's very low for MSF staff. Fortunately, 6 deaths only were reported.
Par contre, à Cité Soleil,
On the other hand,
beaucoup plus élevé.
the mortality is much higher in Cité Soleil, 176 deaths, accounting for 2.1% of the overall sample
Il s'agissait
surveyed
principalement
for this investigation.
plutôt dans la zone sud.
These people are usually men living in the south zone,
On peut la confirmer.
and we expected this, of course.
La caractérisation des essais montre
Now, the characterization of death shows that violence is one of the main causes in both surveys, even for MSF staff members and families. Violent deaths and usually homicides are responsible for the death. In Cité Soleil, homicides, it's in fact exclusively homicides accounted for 40% of recorded deaths. and even 58% of deaths in the south zone. So it's, well, obviously main reason for death in our sample. Our spatial sampling allows us to extrapolate our results to the entire Cité Soleil. If we consider the homicide rate as homogeneous everywhere, in the two areas, around 2,300 homicides may have been perpetrated between July 2022 and 2023, which is, gives us a terrible number of homicides. And we analyzed our data, and it shows that there is a peak in mortality and therefore homicides in July 2022. And we knew at the time there was a lot of conflicts in the neighborhood. But even if we were to remove July from the statistics, well, the homicide rate is still very high. Spatial analysis on the right-hand side here shows that violent deaths were mainly reported around the port of Port-au-Prince, and particularly the neighborhoods of Brooklyn, Boston. It's not New York, but these are the slums in this area, and also in Belle-Écoute and Cité-Lintou, where 70 to 90% of deaths were homicides. So the homicide rate is just huge in this area.
Était l'autre objectif de notre étude. Les violences subies par les membres des
we also wanted to
surtout étaient des menaces.
Identify the type of violence experienced by MSF staff. And they experienced mainly threats or witnessed extreme violence.
De l'exposition à la violence.
And we
avec Cité Soleil que vous allez voir.
So we selected this criterion of witnessing extreme violence, and this is different from what we did for Cité Soleil people. 12% of people considered themselves direct victims, but fortunately, only 3% of them were directly impacted by extreme physical violence. Violent acts. In Cité Soleil, a total of 5% of people were direct victims of violence, but here we
C'était deux choses un peu différentes.
We made a distinction between being a victim of violence or witnessing extreme violence.
Et aussi par arme à feu.
It turns out that 13% of the total witnessed extreme violence, mainly by firearms and physical attacks.
C'est quand même aussi un caractère particulier. Il s'avère que 13% du total des personnes.
And we wanted to identify this, and so.
Voilà, de violences physiques vraiment fortes.
They saw extreme cases of violence, and this is really what stands out from the two surveys. The exposure to violence was the other focus of our investigations.
Donc, je vous ai pas parlé des violences. Là, on a aussi caractérisé la violence envers les biens, envers les.
We also characterize violence against properties, homes, burglaries, and so on.
Dans l'enquête auprès du staff.
So for the MSF staff, half of the households were impacted, but it's also a lot of verbal violence. Whereas in Cité Soleil, 44% of households were impacted by at least one type of violence. Spatial analysis of exposure to violence for households, an exposure to at least one type of violence. On the left-hand side, Cité Soleil, where households were exposed to violence in all neighborhoods in the capital city, and it even affects other areas. And this is the case for MSF staff also, and for all sections. And in Cité Soleil, as we saw, violence affected more particularly the south zone around the port, in the slums around the port, but the north area wasn't spared either. It's the whole community of Cité Soleil that is impacted.
The
survey of MSF families, MSF staff families, was met with mixed success. They have a higher level of education. They live in usually quieter neighborhoods. However, the level of exposure to violence is alarming. No one is spared, and all provinces in the country are affected. Now, this is a survey which is quite unheard of for MSF staff. It's a first. It's a first, but you see, only half of our staff decided to accept or respond to the survey. We had to explain what was the point. Maybe it was not sufficiently explained, and maybe there should be also more communications to the staff about this between the management and the staff. However, the survey was conducted in good conditions with good acceptance in Cité Soleil, and it showed the extent of violence experienced by the population. And we can see that these statistics are slightly above what we collected in 2008. Towards the end of 2023, the United Nations published a new batch of statistics and showing that there was a doubling of kidnappings and homicides versus 2022 that had already a big increase versus 2021.
On peut supposer que les chiffres communiqués par les Nations Unies sont fortement sous-estimés.
And we, considering the outcome of our surveys, we can consider that these United Nations statistics are underestimate the level of violence. So, in conclusion, violence is everywhere in Haiti, and especially in Cité Soleil. The official data are no doubt well below reality, and our results stress the importance of NGOs, and particularly MSF, in this country where aid actors seem to be going away, leaving at a time where the population is in dire needs of them. And it illustrates also that with the forced resignation of Prime Minister Ariel Henry by all-powerful gangs, Haiti has become one of the most dangerous countries in the world for civilians.
Alors, je tiens à remercier
I would like to
cette présentation en classe, malheureusement a été empêché.
My colleague Justin Léon, who helped us with the survey, the MSF teams in the field, the surveyors the people who conducted the surveys, who did a wonderful job. Thank you for listening.
Merci à tous.
Thank you very much. We are going to open our discussions. We're going to take questions from the audience in this room and questions from the online participants. So if you have a question, please raise your hand and ask your question.
Bonjour. Sarah. Salut. Oui, je suis là.
Hello.
Non, ça va aller.
Good morning. Nortan, MSF.
Si j'ai bien compris, l'objectif principal, c'était aussi de communiquer sur les chiffres.
Your main objective was to communicate on statistics, on figures. But did your surveys impact your activities in there? like for mental health or sexual violence activities. In Haiti, well, these two surveys, for the one on MSF staff helped us for the mental health activity, and we are working on a partnership with a psychologist. We sent psychologists there, and 2 more are going to arrive during the summer to support our teams. We also accompanied our staff with shuttle transportation and duty of care activities, and with a long list of things we did for them, depending on the level of violence. Operationally,
Et c'est un élément supplémentaire qui nous a permis de développer toute la partie prise en charge.
We used the survey's results to design our program for victims of sexual violence. MSF Holland had already had something available, but it isn't sufficient. So we now offer a care for victims of sexual violence. So does OCB.
On l'a pas mentionné, mais sur cette enquête, on avait parlé de l'accès.
We didn't say so, but access to healthcare for pregnant women and maternity was one of the elements in the surveys that we used for our maternal health teams, and there's going to be we are going to open and to support maternities in the neighborhood of Cité Soleil. So we changed a number of things in our operations.
Félix, MSF.
Hello, my name is Felix, MSF. I'd like to go back to the communications on Sudan. Now, thank you for what you did with your study, but there were 3 pieces of information: mortality, where violence is the first cause, and also the youth and adults that are more particularly targeted. It may seem obvious, however, what could be the how can you characterize these 3 elements for the crisis in Sudan versus what we observed in other crises or in other emergencies where MSF was involved?
Je vais essayer de répondre à la question si je l'ai comprise.
I'll try and give you an answer because I'm not so sure I understood your question. Now, the main point, I think, for this survey was how specific the people from El Geneina were. So there was a big increase in mortality in the 3 camps before and during the crisis, but more importantly, and on the basis of appalling statistics for these people in the camps. And of course, we don't want to argue that it's particularly in El Geneina, but there was a multiplication by a factor of 20 of mortality, showing that this population displaced and in El Geneina had been the victim of extreme violence, mortality, and of course also with casualties. Did it answer your question, Felix? Well, maybe you can't really come up with an answer right now, but are these elements specific versus when you argue 4% of mortality? Have you other statistics where this mortality was, for instance, just 2% in other crises and it's 4% in Sudan? And in some crises, we could see that people died not because of war itself, or not because of firearms, but because of chronic diseases. And also in other crises, have we seen more women or children affected by the crisis versus what we see in Sudan?
Comparison. I will say that, for instance, last year if anyone was here, we presented some results from the mortality surveys in Goma, and we found similar trends, but I wouldn't say that we can, make this generalization for all different crises. Or I don't think maybe someone else has more information in the room that they could want to add.
On va prendre encore 2 questions et je crois qu'on va devoir bientôt arrêter.
We're going to take 2 more questions and then we'll have to stop. Alain Moren, epidemiologist. I have a question on Sudan and Chad. You have this pre and post assessment, and it's amazing to see that the mortality rate is not very high before the crisis. It's even lower than what you get for 10,000 people in France. So if we underestimated mortality before the crisis, it may mean that the mortality during the crisis is much higher than the one that was measured. So do you have any other evidence about the mortality before the crisis?
Some of it may the recall period may contribute, because it's true that the recall period started in January 2023. We did the surveys in September and August, so this may contribute to the mortality rates in the pre-crisis phase. Yes, but I think, yeah, especially the under 5, which we didn't particularly present, but yes, this is something that we noted when we were doing the analysis.
On va prendre une dernière question, peut-être.
The very last question.
Sauf s'il n'y en a pas.
Unless there are none. There is none.
Bonjour, Frédéric Sorge, groupe de...
Frédéric Sorge.
J'ai une question concernant Haïti.
Question on Haiti.
Des indicateurs,
are there any indicators showing that this violence impacts
les enfants en termes de
child's mortality or care for children in terms of vaccine coverage?
Alors, on n'a pas particulièrement regardé ça.
We didn't really look at this. Child's mortality isn't really high because there were less children were less impacted than the adult population, but we didn't measure the impact on vaccine coverage. But it could be interesting to look at that retrospectively, though we didn't have a specific question on vaccination, for instance. No, what we know is that these people in Cité Soleil don't get much access to healthcare. We can see children coming to us and who are very poorly covered by vaccines. So we have a vaccination with an OPD dedicated to it. So limited access to healthcare for Cité Soleil people.
Où on a eu une résurgence du choléra.
Moreover, the survey was conducted during a cholera epidemic.
Dernière campagne de vaccination.
Or a cholera reoccurrence. And the last vaccination campaign was 2017, so children who hadn't been vaccinated were immunized. And now, I'm very sorry, but we have to leave it there, not to run late.